Earlier, I spoke to Danny Mortimer from NHS Employers, which represents organisations across the health service. I asked him if they were already seeing pressure on services.
We clearly are finding it harder to recruit and bring in staff from the EU, and the reports that we're starting to get of EU colleagues seriously considering leaving or actually leaving to go home or elsewhere do increase the pressure on our services.
So where does that leave us, the patients?
Well, I think the first thing to say to your viewers is that we do other things to cover gaps in our rotas and our shifts, but that obviously does come at some cost in terms of using agency staff and so on. I guess the second thing is that if this trend continues, if we can't provide greater certainty for our EU colleagues, then the risk is that we start to see delays in much needed treatment for people and their families.
We heard from one specialist working here in the West Country that she couldn't even get a mortgage these days because of a Brexit. Is that a sort of common complaint?
I think there are a number of concerns that are being raised. We're now 16 months on from the referendum result. I think everybody is united, politicians included, about wanting to give certainty to EU nationals so that they and their families can plan for the future, and we just need those final steps to be taken now so that people know that they can settle here, they can raise their families, they can get mortgages, they can plan for the future.
A lot of people might be thinking, what on earth were they doing not training enough local staff? Why do we have to go to other countries and rob them of their talent?
I think the first thing to say is that 85% of the NHS workforce are UK nationals, rather. There are times, and there have been times throughout the NHS's history, when it's really benefited from overseas talent and people coming to work with us. And there can be times when actually our demand and demand for our services now is at the highest it's ever been. There's just a mismatch between that demand becoming apparent to us and the time it takes us to train someone. It takes 3 or 4 years to train a nurse, for example, 10 or 15 years to train a doctor. And whilst there are really welcome steps now to increase the number of UK residents joining our workforce, there can be a bit of a gap, and we need to look elsewhere in the world to help us provide our services.
Danny Mortimer, thank you very much.